Hello, my name is Veronica and I will be presenting a goal-focused approach to delirium care for older persons in the acute care setting. Delirium is described by the Department of Health Victoria 2024 as acute disturbance in a person's attention, awareness and cognition. It is a serious condition that commonly affects older persons, particularly in acute care settings, and can lead to adverse events such as falls, pressure injuries, infections, and prolonged hospital admissions. Nurses play a major role in the ability to prevent and manage delirium by implementing various goals and actions such as the ones we will discuss today. The first goal that aims to improve delirium nursing care is aiming to prevent and reduce the incidence of delirium in the acute setting. The first action that will be undertaken to work towards the goal of reducing the incidence of delirium for older adults in the acute care setting is the use of regular and standardized screening tools. A nurse's role in the prevention of delirium onset is of utmost importance as they are the healthcare workers that are in closest contact with the patients and can identify who may be at high risk for delirium. The new desk has been proven to have high sensitivity and specificity in detecting high-risk patients and creating a baseline of cognition. Use of this tool along with other adjacent tools such as the 4AT, which is similarly highly sensitive and specific as well as quick and reliable, provides a clear method of action, backed by evidence, to prevent and reduce the incidence of delirium in older adults in the acute care setting. Through the use of a range of evidence-based, relevant, and accurate assessment tools, this action directly aligns with the NMBA RN Standards of Practice 4, comprehensively conducts assessments. The second action needed is the promotion of personalized non-pharmacological measures to work towards the reduction of delirium in older adults in the acute setting. Burry et al. 2021 suggests that for older adult non-ICU patients, non-pharmacological methods of nursing practice are most effective in the prevention of delirium. Simple actions such as providing earplugs to reduce nighttime noise or nighttime disruptions, to promote good sleep, or increasing the amount of natural light and reducing bright artificial lights has been proven to aid in the prevention of delirium in older adults across many sectors of the acute care setting. Through promoting individualized care that prioritizes the patient, this action directly aligns with person-centered care. By prioritizing quality practice and responding to specific needs of the patient in a person-centered approach, this action aligns with the RN Standard of Practice 6, provides safe, appropriate, and responsive quality nursing practice to work towards the goal of preventing delirium onset in the acute care setting. The third action involved in the prevention of delirium in older adults in the acute care setting is the optimization of hydration and nutrition for those at high risk of delirium. Hydration and nutrition are two key factors in the prevention of delirium. Nurses play a significant role in the provision and feasibility of adequate nutrition and hydration for older adults in the acute care setting. As nutrition and hydration have key roles to play in cognition, the action of close monitoring of fluid balance and food intake are essential in the prevention and reduction of the incidence of delirium. More specifically, nurses can adhere to fluid balance and dietitian orders while working towards individualized nutrition support for all older patients. To do so, nurses must engage in productive interprofessional practice with co-workers such as dietitians and doctors to optimize patients' hydration and nutrition to avoid the onset of delirium in the acute setting. The provision of adequate hydration and nutrition requires adherence to the RN Standard of Practice 2, engages in therapeutic and professional relationships. As nurses must foster a culture of learning, sharing knowledge with the healthcare team such as dietitians and doctors to optimize patient care. For the goal to be effectively implemented, it requires action from various stakeholders and close monitoring of the challenges and the strategies required to overcome them. Stakeholders include acute care nurses, including the nurse management team, hospital administrators, and leaders or members of the interprofessional team. Challenges may arise due to reluctance to change, staff attitudes and time constraints, and hospital administration approvals and support. Strategies needed to ensure the goals' implementation, effectiveness, and longevity are staff education on delirium risk factors, treatment, and incidence, identifying the needs of wards to adequately implement the goal, for example, staffing, resources, and training, and evaluation of both nurse and patient experiences to identify wins and possible changes that are needed. Now we are up to Goal 2. The second goal focuses on improving delirium care for older adults by effectively managing delirium symptoms and enhancing recovery support in the acute care setting. The first action required to work towards improving the management of symptoms and recovery support is using a multidisciplinary approach to provide comprehensive care. Interprofessional collaboration and a multidisciplinary approach work hand in hand to assist with all facets of healthcare, but are particularly important in providing comprehensive delirium nursing care to older adults. Older persons can greatly benefit from a healthcare team including doctors, physiotherapists, psychologists, and nurses that discuss and align their interventions to optimize the evidence-based patient care they provide. In line with their respective roles, actions such as early mobilization, medication management, sleep promotion, and basic nursing care tasks, the multidisciplinary team can assist to manage the symptoms of delirium and support the efficient recovery of older adults experiencing delirium in the acute setting. Through the involvement of the multidisciplinary team, nurses adhere to the RN Standard of Practice 2.6, uses delegation, supervision, coordination, consultation, and referrals in professional relationships to achieve improved health outcomes. By engaging the many skill sets found on acute care wards, nurses can work towards improving the management of symptoms and optimizing recovery from delirium for older adults. The second action involved in improving symptoms of and the recovery from delirium for older adults in the acute setting is effectively reorienting patients and involving regular cognitive stimulation into their care. Aligning with the values and underpinnings of a person-centered care model, reorienting patients facing delirium and involving their family in care facilitates the provision of individualized care. Reorientation specifically has been shown to positively impact the severity and duration of delirium for those in the acute care setting. Reorientation involves affirming the patient's reality with familiar objects and concepts, such as time, place, or person, along with clear communication techniques. Involvement of the family in this process has shown to be effective in cognitively stimulating patients facing delirium to manage their symptoms and streamline their recovery. In this person-centered care approach, nurses align their practice with RN Standard of Practice 5, develops a plan for nursing practice by analyzing the individual needs of the patient, identifying the specific elements that may be needed to effectively reorient the patient. With the goal of improving symptoms and recovery for older patients with delirium, nurses must create evidence-based plans. The third action for improving delirium symptoms and supporting recovery is identifying and addressing underlying causes while optimizing medication management. As underlying causes such as infection, injury, or disease are common precipitating factors involved in the onset of delirium, promptly addressing them is essential in the improvement of delirium symptoms and thus recovery. Similarly, certain medications can harm the treatment of delirium, highlighting the need for medication optimization and careful evidence-based medication use when treating delirium. Antipsychotics are commonly used to treat delirium, despite having mixed efficacy results, meaning nurses must make judgments that favor the patient's well-being to improve the care older patients with delirium receive, with a focus on symptom management and enhancing recovery support. These actions directly align with RN Standard of Practice 1, thinks critically and analyzes nursing practice, as nurses are required to question and analyze treatment methods to provide their patient with the best care. It also requires nurses to holistically look at the care they provide and judge whether it is optimal for patients with delirium. In order to understand the effectiveness and quality of the goal, various evaluations are required. The following evaluation strategies have been ascertained through Otches et al. 2018. Process evaluation. The goal's participation and adherence will require ongoing evaluation through the initiative. This data will come from staff interviews, patient records, particularly notes, and regular surveys. Outcome evaluation. The outcome of the goal will also need close evaluation at the 12-month target timeframe to indicate delirium treatment improvement and recovery satisfaction of patients. This evaluation will arise from comparison with pre- and post-goal patient records, surveys from patients' families, and nurse testimonies. Sustainability. To ensure the longevity of the goal's implementation, evaluations focused on the goal's ability to integrate into daily practice, willingness for long-term participation, and long-term resource and funding requirements are needed. Information can be ascertained through internal reviews, budget reports, and additional follow-up surveys post the 12-month target timeframe. Time to reflect. This assessment has influenced my understanding of delirium and the need for evidence-based practice. It made me realize the importance of a situation I witnessed on placement. Through completion of this assignment, I have also learnt the importance of person-centered care and interprofessional practice. The research involved showed me the importance of person-centered care in both the prevention and treatment of delirium action through individualized care. On placement, I witnessed an older man starting to deteriorate into delirium. My buddy RN used screening tools to implement evidence-based practice into her patient care and identify his level of cognition. Completion of this assessment highlighted that I had seen similar situations, but the quick and reactive nursing care he received was far better in terms of delirium care. This experience also demonstrated person-centered care and interprofessional practice, as she made observations specific to his well-being and care needs, considering other team members that may need to be involved in his care, for example, doctors and social workers. All topics which were reinforced through my understanding of this assessment. I learnt that I need to keep an eye out for early signs of deterioration and use evidence-based techniques like screening tools to provide safe patient care. I will aim to get practice using these tools, such as the tools researched in this assignment, the new desk and the 4AT, in my next placement, and seek feedback on my evaluation skills. This experience, along with completion of the assessment, has influenced how I will conduct my nursing practice in the clinical setting by reminding me of the importance of individualized care and the inclusion of the interprofessional team. It inspired me to consult team members such as doctors, nutritionists, and social workers to prevent and treat delirium in the acute setting. Thank you for listening.